Hi guys, this is Azar, Doctor of Physical Therapy again. Today's session is about elbow instability and ligament instability and the issues that it can cause. Sometimes elbow, as we said, is a very settled and very stable joint, but sometimes the ligaments can get damaged or people can genetically be very loose. One of the samples that I'm going to show you here of the loose ligaments is people that when they put their hand on the floor, the elbow gets kind of that situation. So as you can see, the elbow is not totally straight. So I can show you another picture. This is the elbow that is unstable genetically. So it's going to be hyperextended. So this should be like that degree, but it shouldn't be that much. As you can see, I also have hyperextension of the elbow. Some people, usually women, because of the ligament laxity, because of some female hormones and other stuff and how their body made, they can get ligament instability on the elbow. These people can get more injury on the elbow ligaments. I'm going to show you the ligaments of the elbow, and they are here in the bone, attaching two bones to each other, and they can get tear and with the injury, or they can just be loose and lax without the injury genetically. So anyways, we can have some extra motion of the elbow which is not necessary and is not good. So the only motion which the elbow should have, as we talked about, is the flexion and extension, because it's a hinge joint. It's some down there, some supination, pronation, which that's supination, palm up, and that's pronation, palm down. These are for a little bit lower joint, not the elbow joint, which is the radio-ulnar joint, is in the forearm area, right here, okay? Right now we're talking about the elbow joint. It only has that motion. If we have sideways motions, is wrong. We call it, we test it. We test it and put it like that and put it like this. Valgus, varus, to see if we can get more angled in one side, which I have a little bit angled on the valgus. Usually women have that. If we have this angle, it means that our ligaments are lax and the ligaments are inside of it is lax. So we are more prone to injury if we fall or if we overuse the elbow. We can get unstable elbow, which can cause a lot of problems. As you know, a lot of nerves coming around the elbow, coming down around the elbow, and if we have a ligament injury and then unstable elbow, we can get some pressure on the nerves around it, which is that's very advanced stage. Usually people don't develop that other than if they have a bad fall or injury, or if they are really overusing the very lax ligament of the elbow genetically, and then they're overusing, they're gonna get that. Anyways, if we develop that situation, it's some solutions for that. As we talked, for the tendonitis of the elbow, we had some stretches which I already showed. That stretch, right? This is for golfer elbow, and that stretch for tennis elbow. Now we're going to do some strengthening for be able to get rid of that elbow instability issue. So the first exercise will be this one. Very simple. You all know that, right? Biceps curl. Biceps attaches to the elbow, so it can cause, and attaches also up there, so it can cause instability of the elbow. So we can do it with this, or we can do it with the elastic band. So that's another way of doing the biceps curl, right? Biceps curl can happen in 3 different angles. One palm up, one sideways, and one palm down. Okay? These 3 are different muscles. So different muscles are controlling these 3 movements, and we want to make sure that we do all 3 to strengthen all 3 muscles around the elbow to increase stability. And next exercise is going to be the triceps curl. Easy. You can go this way. If you have a shoulder issue and you cannot go all the way up, then it's other solutions for that too. You can do it this way, extending it, grab it with the other hand and extend. That doesn't need the shoulder overhead. for people that have shoulder problems. And if you don't have band, you can do it this way again with the weight. But this way is not gonna work for that, for extension, because the gravity is gonna help you. The gravity should be resisting you. So what you can do it this way, so the gravity is not helping you. So biceps curl, triceps curl, these are very important. And the next one can happen, we go down there to the radio-ulnar joint, which we said they're controlling what motion? Palm up, palm down, supination, pronation. We can do it without the weight first, if it's very painful in the early stages. And if it gets more painful, we can do it this way. Supination, pronation. If any of these motion causes numbness, tingling on the fingers, we can just stay away from them and go to the easier one, like without the weight, or maybe it's very early for us to do that. We have to do some inflammation control first, as I said, icing, ultrasound, laser, massage, whatever that physical therapist can do in the office. And then if it's a time for the exercises, so you're in the right track, you can come and start doing some exercise without the weight first, and then with the weight, with the easy weight. And the next exercises that I'm going to show you is some grip exercises. Grip is very important for us to have, and the grip can cause inflammation on the elbow. Even in the later stage of tennis elbow, we need to strengthen the grip again. When we get pain-free, we are allowed to do the grip, even with the tennis elbow and golfer's elbow. So what we're going to do, we're going to start doing the grip exercises. We can use a squishy ball and press it. We can use anything. We can use anything that we can squeeze, hold, and relax. And if we have a lot of pain on these areas, it means that we are in the early stage of inflammation still. We shouldn't do that. But if not, we should start doing them. Okay? Another thing we can do is the wrist exercises, and you're amazed at how the wrist can affect the elbow. As I explained and showed you, the muscles in the wrist, they are attaching to the elbow area. So if we do this wrist extension with the weight, we're gonna stabilize and strengthen the elbow joint, but make sure we are pain-free again. Flexion, right? Even sideways, radial deviation. If we do the ulnar deviation, again it's gonna be gravity is gonna help us, which is not good. So we're gonna do it this way, so make sure the gravity is against us, so we can strengthen the muscle. Okay, and then also we can do a lot other things with this little guy, which I'm going to show you later for the wrist exercises as we get to the other wrist injuries. This is all about the stability of the elbow, and I hope you could enjoy that video. If you have any other issues that is not really related to the elbow, and you're not sure if it's related to the elbow, sometimes they come from up here, from the neck, from the shoulder. Make sure you consult the physical therapist and the orthopedist first, and if you need to do the imaging, make sure that it's not from up here. Make sure about that. If it's from the elbow, hopefully the exercise is going to help you, but make sure you always consult with your doctor and physical therapist. Thank you so much for watching. That was the video for the increasing the stability of the elbow.